Hi, and welcome back to another episode of Tanisha Teaches. Today we'll be covering the anterior triangle of the neck. The anterior triangle of the neck lies between the midline of the neck and the sternocleidomastoid. It extends from the chin all the way down to the sternum. The triangle is further divided into four smaller triangles: the digastric, submental, carotid, and muscular. Now let's discuss the structures in the anterior triangle, and we'll go systematically from superficial to deep. So let's first discuss the subheadings. We have the skin, below which we have the superficial fascia, the deep fascia, and the structures below this are divided as structures above the hyoid bone and structures below the hyoid bone. The superficial fascia contains the platysma, the anterior jugular veins of both sides, and the venous arch connecting both the sides. It also contains the submental lymph nodes and transverse cutaneous nerve of neck. So this is easy to remember. You have vein, lymph node, and nerve. The deep fascia consists of the investing layer. So the investing layer of deep fascia in the median plane is a single layer. On each side it splits to enclose the submandibular gland, and between the hyoid and cricoid it is a single layer, and below the cricoid the fascia splits to enclose the suprasternal space. Now let's understand the structures above and below the hyoid bone. Here is a diagram showing you the structures above the hyoid bone. As you can see, the main muscles over here is the anterior belly of digastric, which goes through the pulley that is attached to the hyoid bone and continues backwards as the posterior belly of digastric. The floor is formed of the mylohyoid and the hyoglossus muscle. In addition to this, you also have the submental lymph node, the nerve to the mylohyoid, facial artery, submental artery, and the superficial part of the submandibular gland, which is not shown in this video but is also present in this region. Now, let's study the structures below the hyoid bone. We can study these under three subheadings: superficial plane, median plane, and deep to pretracheal fascia. The superficial plane contains the infrahyoid muscles, which we'll be studying shortly. The median plane contains the pretracheal fascia. So, as the name suggests, it's pretracheal, which means it's present in front of the trachea. This pretracheal fascia forms the false capsule of thyroid gland and the suspensory ligament of Berry, which we'll be studying under thyroid separately. Deep to the pretracheal fascia, we have the thyrohyoid membrane, the thyroid cartilage, the cricothyroid membrane, cricothyroid muscle, and arch of cricoid cartilage, also the trachea and carotid sheath. So I have enlisted them in a way that will be easy for you to remember. So we can go over this list once more. Thyrohyoid membrane, thyroid cartilage, it's one after the other, right? Then the cricos start. So cricothyroid membrane, cricothyroid muscle, and arch of cricoid cartilage. So 3 points related to cricoid. Then we have the trachea and the carotid sheath. Easy to remember. Next, I've made this table which makes it super easy for you to remember all the triangles, the borders, and their contents. Remember that each triangle can potentially come as a short answer question as well. So if you remember this one table, you can answer any question that's asked in the exam. Let's discuss this in detail. The first triangle is a submental triangle. This submental triangle is medially bound by the midline of the neck. The base is formed by the hyoid bone, and laterally it is bound by the anterior belly of digastric. The contents are the submental lymph node and submental veins, which join to form the anterior jugular vein. Let's just review the diagram that I had shown you a little earlier. As you can see over here, the central line is the midline, which extends from the chin in front all the way to the back of the neck. You can feel this hard structure if you just trace on your own chin and trace it to the back, to the top of the neck. You can feel this hard structure, which is the hyoid bone. So that is the region where the submental triangle lies. Next, let's talk about the digastric triangle. It is bound anterior-inferiorly by the anterior belly of digastric muscle, posterior-inferiorly by the posterior belly of digastric muscle and the stylohyoid muscle. Superiorly, it is bound by the base of the mandible. Let's look at the contents a little more in detail. It's divided into the anterior part and posterior part. The anterior part consists of the superficial part of submandibular gland, submandibular lymph nodes, facial vein, facial artery, mylohyoid nerve and muscles, and the hypoglossal nerve. The posterior part is further divided into three subheadings: superficial, deep, and deeper. So superficially, we have the lower part of the parotid, external carotid artery before it enters the parotid, and deep lies the styloglossus, stylopharyngeus, glossopharyngeal nerve, styloid process, and part of the parotid gland. The deepest structures here are the internal carotid artery, IJV, vagus nerve, and submandibular lymph nodes. Now, before we study the last two triangles, I just want you to familiarize yourself with this diagram. You can see a lot of muscles over here, and I know it can seem a little confusing, so I have tried to simplify it as much as possible. Let's study this at three levels: the hyoid bone, thyroid cartilage, and sternum. Now, between the hyoid and thyroid, you have the thyrohyoid muscle. Between the thyroid and sternum, you have the sternothyroid muscle. And between the hyoid and sternum, the sternohyoid muscle. Hope that simplifies it. Let's take a look at the diagram again. Can you see the thyrohyoid extending from the thyroid to the hyoid, which is on top, right? Then from the sternum to the thyroid, we have the sternothyroid muscle. And from the hyoid all the way down to the sternum is the sternohyoid muscle. These are the three main muscles that we want to focus on. Now let's come to the carotid triangle. It is bound anterosuperiorly by the posterior belly of digastric and the stylohyoid, anteroinferiorly by the superior belly of omohyoid, and posteriorly by the anterior border of the sternocleidomastoid. Contents, I have color coded them so it's easy to memorize. The arteries that are present in the carotid triangle are your common carotid artery, internal carotid artery, and external carotid artery, branches of which there is this mnemonic which is given in BD Chaurasya, and I have included over here PSALMS, PSALMS. Amongst the veins that are present in the carotid triangle, we have the IJV, common facial vein, pharyngeal vein, and lingual vein. The nerves are vagus nerve, superficial laryngeal branch, your spinal accessory nerve, and hypoglossal sympathetic chain as well. The lymph nodes, we have the deep cervical lymph node, and finally the carotid body. Let's come to the last triangle, the muscular triangle. Anteriorly, it is bound by the anterior median line of the neck. Posterior-superiorly, the superior belly of omohyoid, and posterior-inferiorly is the anterior border of sternocleidomastoid. The contents of the muscular triangle are the infrahyoid muscles. So let's just revise all the infrahyoid muscles now. Sternohyoid, from the sternum to the hyoid bone. Sternothyroid, from sternum to thyroid. Thyrohyoid, from thyroid to the hyoid bone. And omohyoid.
Thank you so much for staying tuned and actually completing this video. I'm sure that if you've gotten this far into the video, you learned a lot and you will be able to write your LAQs or your short answer questions. If there are any more important topics that you want me to cover first, do mention them in the comments so that I can prioritize those topics and make videos for you sooner. All the best for your exams. I hope this helped.